My name is Danae Barkey, and I am a classical HCU patient, as well as the Executive Director of HCU Network America. We want to acknowledge those who have enrolled in the Rare X Homocystinuria data collection program. We currently have 65 patients from 26 US states and 15 countries and counting. Our current goal is to have a patient from every state and country fully enrolled. We have a lot of ground to cover, so please share with your clinic and other patients and caregivers. Also, I'd like to encourage those who have enrolled or those who plan to enroll to continue completing the surveys. And if you have a genetic report to share, to please upload it. We do have a video on our YouTube channel as to what constitutes as a genetic report, because there's been a little bit of confusion. Those reports are really important in helping us understand what symptoms are associated with the specific phenotypes associated with the homocysteinurias and overall rare disease community. I'd like to thank you for listening to today's Facebook live chat focused on the Homocystinuria data collection program, focused on the heart and blood vessel survey. The survey encompasses 11 different areas. We will only be focusing on a few of the areas due to our limited experience and time. Patients may experience other heart and blood vessel issues that we are not touching on, which are important to share in the RareX platform. I have a little bit of background on this area. The correlation between elevations in homocysteine and coronary artery disease was first published in 1976, and subsequently observations were then made in patients with homocystinuria due to cystathionine beta synthase, otherwise known as classical homocystinuria. It is estimated that half of untreated being the key word there, classical HCU patients will have a vascular event by the age of 30, highlighting the importance of management compliance and early diagnosis. While the documentation for cobalamin disorders with homocystinuria and severe MTHFR, otherwise known as the remethylation disorders, is not as well documented, it is still important to know that there is a correlation. This table shows the individual remethylation disorders and their risk. We have highlighted the specific disorders under this umbrella and their correlating cardiovascular risk. So the more plus signs, the higher chance of these items happening. And so you see there's a lot of cardiovascular things associated with Cobalamin C, and then we have Cobalamin F, and then a couple of things under ENT, and then severe MTHFR deficiency. I'd like to welcome our panel of guests today. I really appreciate them taking their time and sharing their experiences with us. Sam, would you like to go first?
So like Danae said, I'm Samantha Stallings. I am in Kentucky and I have classical homocystinuria. I'm participating in the Rare X research basically because, so I have two rare disorders. And I think it's important for not only the doctors, but researchers to and pharmaceutical companies to make aware, not when they're developing these drugs to help treat us, that not everyone is treated the same. Not everyone has one rare disorder, not everyone may not even have two, may have more. So there's different factors that you have to put into play in order to help get the research and treatment needed.
All right. Misty, do you want to go next?
Hi, my name is Misty. I am the parent to my daughter Sienna, who is 24, and she has MMA with homocystinuria, CBLC with homocystinuria. And just like Samantha said, I mean, it's really important. Research needs to be done. There are rare diseases that are, you know, undiagnosed, and new ones that are, you know, happening more and more. So yeah, we really need research for them.
Excellent. Christa, do you want to introduce yourself and tell us about you? You're muted.
My name is Christa Green. I have classical homocystinuria. I'm from Ohio, in Central Ohio, and I definitely think it's important to participate in research because in a lot of the rare disorders, there's not a lot. The research that's being done is limited, and so the more varieties that they can get to participate in that research is going to enrich and really enrich the knowledge of our doctors that are across everywhere. And so being able to give them as many points of view and different individuals who can participate is really important to be able to lay that foundation for the next generation to come through and actually have. I mean, even looking back from when I was a child to what's available now for the kids that are diagnosed, it's night and day of what's out there. And so, but we wouldn't have that if it wasn't for those who came before us and participated. And so there's my soapbox.
Well, thank you so much. And I can agree more. Every generation helps lay the groundwork for the next. And I'm hopeful for the kids that are just being born, that their lives will have a lot more treatments available to them. And it's crazy to think what things look like 10 years ago and what will they look like in 10 years from now. It's really exciting.
Face to face with someone else with the same disorder is like huge, because I honestly had never met or seen or knew of anybody else who had what I had, I think, until I was 20. So that's a really long time to feel like you're on an island, but it's all really important. That community is huge.
Yes. Well, let's first talk about the current guidance on cardiovascular care for the homocystiniurias. Currently, the classical guidelines recommend that patients have a lipid profile completed along with a cardiovascular risk factor assessment, that's a mouthful to get out there, completed once in childhood and then annually as an adult. And I have a feeling some of that could be changing here as they update the guidelines, and also as we participate more in research. The gene review for the disorders of intercellular cobalamin disorders, so that's really Cobalamin C through Cobalamin X, they recommend routine echocardiograms. So those are the big things for the homocystiniurias. It's important to note, though, that the guidance was created after each of our panelists were born and diagnosed. And the reason why I point this out is because you can't necessarily undo the damage that has been done. And so there's a lot of assumptions that I think get made by others because of the things that we have experienced. So my first question is for anyone who would just like to chime in, and then we'll go more into detail about each of our experiences here. But prior to exhibiting symptoms, had any of you had any cardiovascular testing done prior to symptom onset? So meaning, they just did it in general before you exhibited symptoms, like if they were following a guideline.
I have. When I was 8, I was seeing actually a pediatric orthopedic that kind of figured that there was more, I don't want to say wrong, but like more to me than just my foot having something wrong. He sent me to a neurologist, and the neurologist actually did had an echo done, and it showed there were some abnormalities within my heart. And so from the age 8, so now I'm 30, I've had heart echoes every 6 months.
Wow, that's a lot of heart echoes. Misty and Christa, did either of you have any cardiovascular testing done prior to symptoms?
No, Sienna did not.
And that's why I think it's important to also highlight, the guidelines that are now in place, because I actually just now in my late 30s had my first echocardiogram, and I was like, well, that was long overdue. And that's why it's also important that we share that information and make sure that we are involved in our care. All right, so the first area, I kind of lumped them together here in the survey. We'll start with things that tend to just in general affect the general population, but patients are more at risk for. So high blood pressure, high cholesterol, hyperlipidemia. All hyperlipidemia means is that your blood has too much fat in it, or cholesterol or triglycerides. And so, Misty, when Sienna was first diagnosed, when was Sienna first diagnosed with high blood pressure? Because she's still pretty young, and so
Yes. It was, she actually was diagnosed with high blood pressure and her cardiomyopathy at the same time. And she was 14, and we were actually diagnosed at NIH. She was in a study with Dr. Vendetti. She's still in that study, and they actually diagnosed her. She wasn't really showing very many symptoms, but when we got back home, she started showing them, and no one would listen to me. They didn't want to believe me. And so we ended up having to see, I think we're on our 4th cardiologist before they would listen to me, before she got treatment.
I only laugh because it's like the amount of medical gaslighting that happens in rare diseases, just it's mind-blowing. And I don't think that people outside totally recognize that. And so has she had any complications because of the elevated or high blood pressure?
She does have intermittent high blood pressure. Sometimes she still has dizziness and tachycardia. So yeah.
Okay. And when they diagnosed her, did they recommend any lifestyle modifications, or have they put her on medications to help control it?
Yeah, she's been on 2 different medications. The first one lowered her blood pressure too much. And so now she's been on the second one probably for close to 3 years, and she does pretty well with it.
That's good to hear. I was just recently diagnosed with high blood pressure. We haven't got into the medication part yet. They were like, try more lifestyle things, but it's like, there's only so much you can do. Our diet's already limited with classical homocystinuria. Like, I'm not sure how much more I can do. And I've already worked out, so we're quickly eliminating the possibilities. The other areas that are in here that I think are important to note, but we didn't have these indicated, high cholesterol and hyperlipidemia. None of our panelists, including myself, indicated this area, but we want to note that even though we have not experienced this, it is important to be aware of. You can still have overall high cholesterol, even with a low protein diet, that classical homocystinuria patients are often prescribed. Part of it is because it relies heavily on starchy foods, butter, oil, things that aren't necessarily fantastic for us. And so
food that we can actually eat.
Yes, exactly. So it's still important to monitor. Do not ignore that lab work. Also for cobalamin and MTHFR, where a low protein diet is not advised, it used to be one of the things they're stressing now more as a heart healthy diet. And that means, limited red meat intake, if any at all. That includes pork. There's a huge myth that still exists today that pork is not red meat. It is red meat. And I didn't know that until recently. So limit or eliminate the intake of those, and try to eat oily fish at least 2 times a week, in addition to the plenty of vegetables and whole grains. That is for our cobalamin MTHFR community. Obviously, typically on a low protein diet for classical homocystinuria, you're not going to have an allowance that allows you to eat fish and most whole grains. So
the heart healthy diet, with the cobalamin, is it also a salt restriction? Like, do they follow the salt regulation for the heart healthy piece too?
I haven't, they didn't, when I talked to the folks that we use for guidance, they didn't mention it, but that doesn't mean they don't. It just wasn't included in our conversation. But I think, knowing that high blood pressure can be a concern, I think it's important to monitor your sodium intake and see how that looks in your blood work and panel, because you can have high blood pressure and actually not have high sodium intake in your lab work. So I think that's a really good question though to ask.
A lot of the low protein foods as well, and just foods in general that are low protein, have a lot of added salt. So that's another big piece to kind of watch for, just because we don't consider it to something to look at, but it definitely plays into that factor for everything heart related.
Yes, I cannot agree more. It's very processed diet, especially if you're leaning heavily on the medical foods. All right, so we're going to pivot here into abnormalities in the heart and blood vessels. Samantha, you had mentioned earlier that in addition to having classical homocystinuria, you have another rare disease. Would you like to talk a little bit about, if I mispronounce this, please correct me, but is it Loeys-Dietz syndrome?
Loeys-Dietz.
I know it's not a part of HCU, but I think it's important for people to understand, because there are some crossover.
There's actually a lot of crossovers. I think you and I talked about it.
Yes.
Many times, especially in the last couple of weeks.
Yeah. You mind talking a little bit about what that is and the risks that you have associated with it and your experience?
So Loeys-Dietz is very, very similar to Marfan's. It's actually in the Marfan family. So if you don't know what Loeys-Dietz is, which many people do not, they've heard of Marfan's, and Marfan's is in the same family as Loeys-Dietz. The only major detail or difference is I am prone to aneurysms anywhere in my body. So with Loeys-Dietz, I have let me rephrase that. My heart is prone to, my aorta is prone to grow as it so chooses. In the last, until, I think it was like last spring, my aorta had not grown. It has grown to very close to surgery threshold. And you and I have actually talked about it a couple weeks ago, how within the last year my aorta has grown. And I was actually talking to my mom about it again today. You were telling how the more homocystinuria patients are starting to see that the later that they are diagnosed. I was not diagnosed with either homocystinuria or Loeys-Dietz till I was 23 years old. I was very lucky and fortunate not to have any symptoms, or let's put it more this way, deadly symptoms or, neurological symptoms that would have put me back a while. I kind of, on the difficult part of having both is Loeys-Dietz kind of limits me on how much exercise I get. Well, not really technically exercise, but weights I can lift. So being on a low protein diet is not the best having Loeys-Dietz, because you're not eating as much meat. But if I just had Loeys-Dietz, then I could continue, because I can't build a lot of muscle, and so that it's kind of gone back and forth on which is which. And I was actually put on 2 beta blockers. I was put on one when I was 8 years old, and then another one when I was about 24. It's only changed a little bit since then. But the beta blockers have made a huge difference, and researchers are starting to show that beta blockers are starting to slow down the process of heart growing, and hopefully that will help on both sides of the spectrum of homocystinuria and Loeys-Dietz with my heart. Another thing that I don't know if we actually don't know why it started, because this was back when I was in college before I was diagnosed with homocystinuria or Loeys-Dietz, but I did have some PVCs, which are premature ventricular contractions, which are basically early heartbeats. My doctors are kind of thinking it may have had to do with anxiety, but I don't think I was anxious at all when I had them. But I get monitored, like I said, every 6 months to check not only my aorta, but I get an EKG with it, just to kind of check everything and make sure everything's in place.
That sounds good. Thank you. And that was helpful too, because you talked about, the activities that are limited by those things. Because we talk, a lot of times we talk about heart health, we talk about eating healthy and exercise, but I think it's also important, to remember that for some people, those things aren't always going to be possible.
Right. That's why, like, I've always been a swimmer. And so my doctors have always claimed, like, you may not have had all the things that could have happened at a young age because you were a swimmer and you were active. I was a very active child. I was playing almost every sport known to me until I was about 7th grade. And then I was told I had to stop all contact sports because I had a Chiari malformation. But I kept swimming, and even today, my doctors keep saying, like, swimming is the best thing to do, because I can't, like I said, I'm not allowed to run, because of my, excuse me, my heart issues.
Mhm.
Anything that would raise my heart, have to watch what I do.
And you don't want any more issues. So I feel like we all have enough on our own without adding to it. Thank you so much for sharing that. So another part of this area of the survey is cardiomyopathy, and cardiomyopathy is a disease of the heart muscle that makes it harder for your heart to pump blood into the rest of your body because it's not functioning right. This is listed as a symptom on the chart that we showed earlier, with a higher rate for those with Cobalamin C, like Sienna. Misty, can you tell us how Sienna is impacted by her cardiomyopathy diagnosis, to monitor it?
Well, she has an echocardiogram usually once a year, year and a half. They're not as strict or as they were when she was, in pediatrics. So they want her to do some exercise, because it is good for your heart, but no strenuous exercise, obviously. But she still has a really hard time with that, because sometimes just walking will cause her to have, tachycardia. Also, another thing with Sienna is she, is blind, so she's limited on what kind of exercise she can do. But she also has neuropathy in her hands, legs, and feet. So, sometimes it's hard for her to do it. But yeah.
I know there's so many compounding factors, and we have the discussion a lot with my daughter. She's 4, so she's still very little, but because she does not want to eat what dad's eating, she'd rather eat what I'm eating, because it's basically, it's the thing she doesn't want to eat that he's eating. And so we talk a lot about, what's healthy for me is healthy for me. What's healthy for dad is healthy for dad. And what is healthy for you is going to be different too. Because my husband also has high blood pressure and high cholesterol. So, we all have to do what's in our best interest for our bodies versus, trying to treat us all like we're the same, which as rare disease patients, we know that is not the case. All right. So the last area are things that patients and caregivers that we probably fear the most, and those are strokes, heart attacks, and cardiac arrest. Christa, I know you've been through so much. Would you be able to? I know there's a lot of confusion, and honestly, for myself, I didn't totally understand the difference as I was working on planning this. And so, if you're able to, would you be able to talk about the difference between, strokes, heart attacks, and cardiac arrest? And if you don't feel comfortable, I can read what I have found on the internet, but I think it's better when it comes from a patient experience. Oh, you're muted.
So a heart attack is when one of the coronary arteries are actually blocked. So in my head, visually, it makes more sense to explain it as it's a stroke of the heart. So it's where the vessels are blocked. And so and the cardiac arrest is when there's actual heart failure. So that's when the heart fails to be able to beat enough blood around the rest of the body to the organs so they can all have all the nutrients and oxygen and everything they need. A stroke is sometimes called a brain attack because that's usually where it occurs. And but sometimes there'll be a blockage somewhere else. That blockage still blocks the blood supply to the brain. So it can also be when a blood vessel in the brain actually bursts. So those are the three different. So brain is more commonly known as the issues that happen in there are stroke related. But your heart can have its own stroke as a heart attack. And if it stops beating, then that's the cardiac arrest piece, to which I've had all three. So for me, I exhibited no symptoms whatsoever as far as anything cardiac, anything cardiac, or I'd never had a blood clot. But for me, when I was 30, it was the day after Christmas. I had just gotten in the shower. My husband had a migraine, so we chose that we were going to leave a little bit later to visit family in the holidays. And then suddenly I had a Charlie horse in the lower left side of my boob. And so I thought, like, that's a really weird plate. Maybe I slept wrong. And so I just kind of brushed it aside. But then all of a sudden I got really dizzy to the point I couldn't actually stand in the shower. And so I had sat down, and then I got like nauseous immediately and got sick to my stomach. And I'm like, we must have had bad food for the holidays. Or I was thinking maybe it was food poisoning. So things progressed, and the pain kind of changed. It was in the same area, but it changed to where it felt kind of like an arrow had gone straight through, and I could feel it on my back as well. And so I actually have a giant 160-pound dog who actually came over to the bathtub and helped me out of the tub. But once we got to, and I woke my husband when we got to the hospital, they completely dismissed all of my symptoms and said, oh, it's just an anxiety attack. You're only 30. Even though I had told them I have homocystinuria, these are the things that can possibly happen. Are you positive it's an anxiety attack? Because this does not feel like anxiety attack, and I'm actually not one to really ever have anxiety. Usually I'm a pretty go with the flow. And sure enough, when they hooked me up to the EKG, my doctor's face completely changed, and immediately they were like, nope, this is a legit heart attack. And within 5 minutes I coded, and so I had cardiac arrest. Wow. And so it progressed pretty quickly. So don't let them dismiss you. Make sure you get it checked out. So not only with homocystinuria is it important to watch those symptoms, but as a woman, we have very different symptoms for cardiac issues than men do. And some of mine were classical symptoms, but even though I'm not of the typical age that many think of for those symptoms, that was a big one. For the stroke, the only thing I can remember that happened prior was within that week prior, I was going up the stairs, and I remembered my foot all of a sudden felt heavy. And I'm like, that's really weird. Like I didn't change my shoes or anything. And so I thought, well, maybe I just didn't drink enough water. But that was really the only symptom prior to my stroke. But one thing, when I was talking to my husband about the symptoms to see what else happened, he said, make sure you share with them that knowing that these things can occur is something we talked about extensively prior to it happening. And so the fact that for him, he was able to get the emergency response as quick as he could, that changed the whole ability for me to be able to overcome the issues that I experienced from the stroke and the heart attack. So I have over 80% back of function and all different things, from the stroke because of how fast the response was to be able to get treatment for it. So it's definitely something to talk to your family about the possibilities. Doesn't mean it's going to happen, but just knowing that those are possibilities is very important for them to be able to communicate to the emergency response team, and even just to know to take things seriously. Because it's much better to go and get checked out and know that you're okay versus not address it and wish you would have went. Because like you had said at the beginning, once damage is done, it's done. Like there's no undoing damage, unless you get treatment in fast enough time for there to be muscle memory to even come back, especially in the stroke piece. But yeah, so that's
there's a few kids in the community that had strokes. That was their first symptom, and it's amazing how they've managed to recover. It's absolutely, you wouldn't know. There were a few of them that were about 2 when they had theirs, and they've made amazing recoveries. Kids, though, I think are obviously going to be different in their recovery anyways than adults. Since those activities, not activities, I apologize, that was a bad word choice. Since those events, what kind of things do you do to decrease future risk? And do they tell you to avoid anything or make specific lifestyle changes to lessen progression or to help manage?
So I will admit, as one of the researchers, I did get to do one of the research trials for the taurine study, but so the doctor there he labeled me as a big ticket homocystinuria individual. So I did the low protein diet, but I did it as a big ticket thing. So and what they mean by big ticket is it's the things that are the highest amount of protein, like meat and eggs and cheese, and so I did follow the guidelines for the big ticket items, but for the items that weren't necessarily the big ticket things, I didn't watch as closely to my diet. So I was guilty in that. I also was anti-juice. Like I did everything I could to drink it, but it gave me so many adverse reactions to it that it just, for me, wasn't like I would rather just deal with the diet part, at least the big ticket pieces, because I had never experienced anything negatively. So like you think of people who have allergies and okay, you don't eat that because you have an allergic reaction. Well, there had never been anything for me that I had experienced as an adverse effect. So I just followed the big ticket things. And so with the now obviously between the heart attack and the stroke, I was following the heart healthy diet, the low sodium, and I still do the best that I can with it. Salt is one of those that you can always do better in, but and then making sure getting the betaine in, or betaine, whatever some people call it, one or the other. That's super helpful, and following through with doctor's appointments so that everything is routinely checked. I have an amazing heart failure doctor. I never wanted to know that you can have 6 different cardiologists because they all have a different job. One's a plumber, one's an electrician, one's the sub pump guy, there's so many different kinds of cardiologists. That was not anything I wanted to learn that I needed at this age. But making sure that you're following up with all of those people and that your team is communicating with each other. So I actually had to get a nurse advocate to tell the doctors, okay, you actually have to communicate with the geneticist, because the geneticist I just learned 2-3 weeks ago, he had no idea I had a stroke a year and a half ago. But I had been telling them that, and nobody had actually forwarded that information to me. I actually have to. So making sure everybody's on the same page and has the information is really important. And sometimes you're your best advocate. So don't be afraid to continue to advocate and just assume that everybody knows, because they don't. They all work in their silos. And that's a big piece for me. The other thing that I've had to change lifestyle-wise is I was told that I have to deal with stress differently. My husband and I have a son who is now 20, but but he's adopted, and he came to us with a lot of trauma and just items that cause parental stress while raising him. And so that was just a part of life. And so, making sure you have positive stress management, and you're actually using stress management on a daily basis is huge. So make time for that stress management, because even though you can't see it on the surface, it affects you internally, and it affects how your body is working, and can help you or hurt you. That's a huge piece with that. And I think that's the biggest piece, is just being conscious of what goes in the body, as well as conscious of how you're treating your body and how you're advocating for your body.
Yes. I like that part though, like you talked about stress management, because I think even outside of patients, in terms of caregivers like Misty, the stress doesn't stop just because Sienna is an adult. She still needs help. And I think that's one of the things that we tend to, and as parents in general, we tend to put ourselves in the back burner, and we make ourselves last because our kids come first, because they're kids and they have needs. And so always remembering, like, it's like that old adage of, you've got to put on your life vest first, and so you can help others around you. And so it's really important to take care of yourself, patient and caregiver. And
I don't want to interrupt, but I just want, my mom is watching. So she's also, I live with my parents, and she's, been my caregiver for most of my life, and starting to learn how to do it myself. But another thing that kind of, it's more on the cardiovascular side, is POTS. So y'all were talking about, staying away from sodium. For those that have POTS, staying away from sodium is not the best thing to do. I have POTS, and I remember when I think I was diagnosed when I was around 8 or 9, and I would be passing out all the time.
Mm-hmm.
And my doctor would be like, "Are you eating enough salt?" And I go, "No, why do I need salt? I don't want salt." And he like threatened me. He goes, "If you do not eat enough salt, you are going to be on a salt pill." And so that kicked me into high gear. And like, okay, I mean, even though I'm 8, 9 years old, I'm putting salt down on my food because I didn't want to pass out anymore.
Yeah, and that's very true, Samantha. It's understanding the balance of what your body needs is huge. Mm-hmm. So a lot of people will just do the polar extreme of like, okay, well, if I can't have this, then I'm not gonna have any. Or if I can have this, then I want as much as I can. But finding that balance is hugely important for our entire systems, because we can't just focus on heart. We can't just focus on blood vessels, or just on brain. It's because everything interacts with each other and it affects each other. And I mean, they're learning more and more science-wise with the gut-brain connection. And really, there's an everything-brain connection. It's not just gut-brain. So being able to balance each of those things is really ultimately the biggest goal that we need to have as a whole.
I think that's a really good point. And also, as we age, we tend to acquire more problems. It's just one of those things that happens as we age. And so realizing we do have to kind of balance the whole picture, because I mean, if someone would have like said to me 5 years ago, "Oh, you also need to worry about your blood pressure. Think about what you're putting into your body." I'd be like, psh. But it's the fact of the matter is around 40 people's blood pressure actually does. That's when you start to see elevations in blood pressure. So what I have might not be, but it's just, you have to take care of your whole body. And it is a balance thing, which I feel like it's definitely trickier, in the rare disease community, just because we can't do a lot of the things that they typically recommend. And also, there's a lot of things in the stuff we eat and drink especially, like there's sodium in Gatorade, there's sodium in pop, and most people don't think about that. And so stuff is hidden everywhere. So being aware of what we put into our body is is really important regardless of low protein diet or not, just because we have to carry our bodies into adulthood and deal with adult body problems too. So I really appreciate that. And I also wanted to note, Christa, so I had a blood clot in 2009. Mine was in my wrist, very weird blood clot, but I was the same way where, you know, you've been warned for so long about these things. So it's like, well, I wasn't really eating meat and I wasn't, you know, I thought I was doing okay, but it clearly, you know, pasta and bread they're not okay when you're only allowed 15 grams of protein. And so it's, you know, and you don't see the consequences until they're right there in front of you. And then you have really big decisions to focus on. It's a very unfortunate side of things, just because it's not like a peanut allergy where you have anaphylaxis, which is just as dangerous, but it's a much slower progression, and then it affects other parts of your body too.
I also had never been told that blood thinners might be something that I needed to have been on until I had that heart attack. My doc, that was never even on a radar, and I didn't even know to ask that question in like our Facebook groups because it was never talked about. It was never on the radar. But because of the platelet issue, that's a really big conversation that you want to have with your doctors, because the reason those blood clots form is because of the platelet piece and the fact that our blood is sticky. And so if you're not getting your blood checked in that manner, you don't know if your INR is too high. And so when I actually had my stroke, my INR, and I was on warfarin at the time, which is, you have to go and get it checked every few weeks. It's awful. But because of the low protein diet, and I'm not one to eat, I don't do a lot of the low protein boxed foods because of how processed it is and because of how much salt it was. But so for me, I do a lot of vegetables, which you have to watch very carefully because the vitamin K can interact with the warfarin. And so what ended up happening was I was subtherapeutic in my numbers. And so that is what caused the clot to, well, I actually had 2 clots during my stroke. So I had one here and I had one up here. So it double whammied me. So I don't do anything small. If I'm going to go at things, I do it big. So I tell my husband I'm getting all those out of the way for the golden years so they can be smooth sailing. But that's the big thing is to make sure that you're, you know, you are getting those levels checks. I just learned with my geneticist a few weeks ago that there's actually a test that I can have done that will assess all of my blood vessels in my entire body to make sure everything's clear and running good, that I can have done annually. So there's actually a test out there where you can actually have that assessed. So it's like making sure all the pipes are working. I mean, I feel like, you know, at a certain age, you have to go and get your gut checked out in the not fun ways. So, I mean, we definitely need to make sure all of our vessels are clear in working order. So knowing that these different tests are out there is just part of the education process. I wish there was a way to download everything that we needed to ask about, but this is how it's here.
So you brought up another good point, is like there are so many tests out there, like because of my Lloyd states, yes, I do get echocardiograms every 6 months, but every other year I get a cardiac / full MRI with what's it called? Contrast, to check for aneurysms anywhere in my body. So that's like another cardiovascular way of testing.
Yeah. And that's why I think it's so important also, because the stuff that they're collecting in RareX is stuff like this. And this is, so Dr. Chapman reviewed the preliminary data with HC Network America back in the fall. And there was an alarming rate of oral health issues. And she's like, well, we're getting ready to revise the guidelines. Let's make sure that the guidelines address this area. And so by us contributing, we can help revise the guidelines. There's Cobalamin and MTHFR guidelines too. And so but the more people that that participate, the better understanding we have, and the more fine-tuned the guidelines can become. And so, you know, it's just another reason why it's so much more important. And those guidelines then typically will recommend whatever test. And so obviously, as new tests and technology becomes available, they can update that too. We're at time though, so I just want to start closing out here. But I also am so incredibly thankful to the three of you for joining tonight. Our health is important and it should be taken very seriously, as we have seen here. And I loved Christa's point of making sure that our family members and even our coworkers, because we don't know when things are going to happen, that they're aware of things that could happen and how it might look, especially males versus females. I think that's a very important point as well. And so especially with such major risk at stake. So please talk to your doctor about the current guidelines if they're not already doing these things. So to recap, for classical homocystinuria, the guidelines currently recommend that patients have a lipid profile completed with a cardiovascular risk factor assessment completed once in childhood, then annual as an adult. They might recommend it starting in your teen years. So, and like I said, that those things could be changing. For cobalamin patients, there's a gene review publication for the disorders of intercellular cobalamin disorders. And they recommend routine echocardiograms starting in childhood. So you can also view our cobalamin monitoring recommendations. These took the European homocystinuria remethylation disorder recommendations and the gene review one and combined them together into one easy to use format. And so this is available on our website under hdnetworkamerica.org. And then you go to the resources tab, toolkits and checklists, and go to the cobalamin resources. And so it talks about what to monitor at every visit, what to monitor yearly, what they're looking for, and what the risks are associated with them. And so you can see here, not sure why it's doing that funny stuff, but what tests they're recommending and the risk associated with them. And if you can't find that on our website, you're welcome to email us and we can forward that to you. Is there any last minute advice that you guys would like to share with patients or caregivers before we go?
I think the thing is, you know, on a second note with the gene review, our bodies respond to stress differently, and it's a genetic, it can also be a genetic component to how it responds to stress. So, you know, being able to have that gene profile and know kind of what where your genes are, it does give you an advantage to know, okay, I might react more adversely because of these genes. And just having knowledge is power. And so participating in things like the gene review, that's only going to help you. And it's going to help those who are working with you to know how to best treat and come up with strategies and the whole process. So I think just making sure that, you know, as the, you know, there's my soapbox for the gene review. So I've seen in the field that I work, just knowing that your genes do play a huge part, even if other people don't have the homocystinuria. There's more than just your rare disease gene that plays into the factors to how your symptoms are going to affect you long-term wise. So that's a big piece.
Yes, and I feel like they're untangling more every day in understanding that. Misty, it looked like you were going to say something too.
Just touching on what you we talked about earlier about caretaking. You know, it's a hard job. So yes, you do need to take care of yourself as well. I did not. I let my health really put my health on the back burner because Sienna, you know, always focusing on Sienna, and she has a lot going on besides, you know, Cobalamin. So, and my health really took a big hit. So yeah, you know, it's really important as caregivers that you know, take care of yourself, because you're not going to be able to take care of that person if you're not well yourself. So
Yes, and there are other support groups specific to helping caregivers too. NORD also has a respite program for parents who are caregivers for their children, which I think it's really important to understand which resources are available, just because it is an intense job. And you know, a lot of people think, oh, your job ends when your child turns 18, and as we know, it does not end when your child turns 18. And in general, it typically doesn't. I'll be quite honest. I'm one of 8, and even my brothers who don't have homocystinuria, they're all younger than me, but all in their 20s and 30s. And, you know, we all need our parents' help and support. So your job doesn't end, rare disease or not, but the job is just that much more intense for those who really are, you know, the day in, day out provider. So thank you for sharing that as well, because I can't impress it enough. And as patients too, we have to take care of our mental health. We focus so much on the physical health. We can't forget about what's up here, because that is going to impact how we treat our bodies as well. But I appreciate Sam, Christa, Misty, I appreciate each of you and your participation this evening. And again, I'd like to thank everyone who has participated in the Homocystinuria Rare X data collection program. If you haven't created an account, there's still plenty of time. There's no time frame that says, oh, you can't participate. And we are really working to get patients from around the globe in every state on that map that I shared earlier. And so it's just going to help us better understand the conditions and drive change, you know, for better understanding how it affects us in future therapies. If you have not enrolled, you can do so today at homocystinuria.rare-x.org. I always forget the dash. And we'll put that into the link in the video too. So if you have any questions for the panel, you can reach out to us at info@hcunetworkamerica.org, and I will be glad to forward those questions. But I appreciate everyone's time this evening.